I've basically almost exclusively hired people who have ADHD or autism because I figured that they're going to understand the target market and they're going to care about the product that we're solving as well. And maybe that's something that could be done more broadly in the digital health space, that if you're building an app to help with depression, then hire people who have been through that pathway before and who've experienced the challenges.
Welcome to the Message Engineer for the Medtech Startup. We're so excited today to have Jeremy Nagel here with us. Jeremy is a neurospicy software developer and a passionate startup founder. During his after hours, Jeremy channels his energy into his current side business, FocusBear, or FocusBear.io, where he builds software-enabled tools to help neurodiverse individuals thrive in the workplace. Previously, Jeremy's entrepreneurial spirit led him develop an SMS integration for Zoho CRM called Smooth Messenger, which he sold to MessageMedia, where he now works. So Jeremy has previously worked in EdTech and clean tech companies, and he graduated with a Bachelor of Environmental Science in Bioinformatics and Data Mining from Monash University in Melbourne. So welcome.
Great to be on the show. Thanks, Maureen.
All right. So we always start with define the word warm up. And so your thoughts and ideas and opinions on these words. So I have three. The first one is founder.
Founder, I actually really like this term because in the past, people used to call themselves CEO, even if it was a really small startup. And I found that a little bit ostentatious, to be honest. And whereas founder conveys the idea that it could be small, but we're still passionate about it and it can grow into something quite large. I like that, for example, the founder of Atlassian and Canva, which are two very large tech companies in Australia, they still call themselves founders rather than CEO. And that makes me feel, it feels like it conveys a sense of creativity and energy and building something new.
That's great. I love that definition. And you're going to make me rethink what I put on my business cards. Second one, near and dear to your heart, neurodivergent or neurospicy, which I thought was a really interesting term you used on your LinkedIn profile.
Yeah, so I guess the dictionary definition of neurodivergent is someone who is part of a neurominority where they might have ADHD, autism spectrum disorder, dyslexia, Down syndrome. There's about 15 different conditions or traits that would fit into that definition. And the reason I prefer neurospicy is because I find neurodivergent feels very medically and it's more in the deficit model rather than playing into the strengths. Because, for example, with ADHD, it's an attention deficit disorder, an hyperactivity, but it doesn't really convey the positive aspects as well, that there can be a great amount of creativity that comes with having ADHD. And the same with autism, that it's not necessarily a death sentence to someone's career and someone's social life, that there can be a lot of positive aspects to being autistic. And that's what I've experienced myself. And so I like to lean into the idea of neurospicy, which conveys difference, but more in the sense of variety being the spice of life rather than difference being bad.
That's a great definition and a really terrific point about the medical terms often being from a deficit perspective, right? As opposed to flipping it and the kind of glasses half full and the strengths perspective of it. So great point. And word near and dear to my heart, message or messaging.
Yeah, I guess for me, messaging is around how do I communicate in a way that isn't jargony, that is going to resonate with the people that I'm trying to help. And that can be a bit of a challenge if I'm doing something new. That with FocusBear, there are a few, I guess, competitors out there, but they're not really targeted at neurodivergent or neurospicy people. So communicating how it's different has been the opportunity and the challenge. And that's where I don't know that I've actually got it 100% right, but being able to experiment with different messages and seeing which ones resonate has been my journey over the last 18 months.
That's great. It is, I think, any good messaging in any great company is a work in progress, right? We learn and we do. The goal is at least to do better, right?
Yep.
So I think to roll back to your current kind of, FocusBear. I mean, what inspired you to start FocusBear? I mean, and how did your personal experience with ADHD, and I think you had said ASD level 1, play a role in your kind of entrepreneurial journey?
The inspiration for FocusBear was the sale process for Smooth Messenger, my last business. At the time that I was negotiating the sale, I was going through probably the most stressful experience of my life, in that I had another job that was paying the bills for me. I was working on Smooth Messenger as another business, trying to keep it afloat, which involved having to wake up very early to look after US customers, because the majority of customers were in North America, and then also dealing with customers in Australia and Europe. And I was feeling stretched very thin already prior to them reaching out and saying, hey, we'd be interested in buying it. And then on top of that customer support burden, I then also had lawyers and accountants that I was talking to. And it just felt like I had no time for self-care at a moment when I actually really needed to be able to de-stress, because the negotiations got quite tough at some points and I was very attached to the outcome. So I knew that it would help me if I meditated, and it would help me if I exercised, because they were self-care practices that I had done in the past, but I couldn't seem to get myself to do it. That I'd wake up and I just have this gnawing pit of anxiety in my stomach. And the way that I solved that, rather than going and meditating, which would have been a better way, was I'd wake up and I'd go straight to my emails and check what good or bad things would be awaiting me there. And normally it didn't actually make me feel less stressed. It got me into hyperfocus, and then I'd look up and it was 3 hours later and I no longer had time to do those self-care practices that were so crucial for actually being able to de-stress, but also be able to focus. Because as someone with ADHD, I've realized that some of those practices are really crucial to me being able to actually channel my hyperfocus. That if I don't meditate, then I end up being very scattered, and I do operate more in the deficit model of attention, that I'm constantly looking around and I'm doing 10 different things and not really making substantial progress on one of them. Whereas if I exercise and I meditate, then I'm able to move forward with the harder things on my to-do list, and I make a lot more overall progress. And I wanted something that would actually stop me from checking my emails first thing, because I identified that as being the real destroyer of my self-care plans. So that was the original motivation for FocusBear, to help me with my own challenges. And essentially what it did in the early days was it took over the whole screen and it said, you can't do your meditation until you do your meditation. Sorry, you can't check your emails until you've done your meditation and exercise. And it would have a countdown timer and showed a YouTube video of someone meditating, and I just copied along with that. It was really effective for me. I just started with a very small morning routine, 15 minutes in total, because that's all the time that I had at that point. And then I progressively grew it from there, both in terms of the strength of the app, but also my own personal morning routine that I went from doing 5-minute runs in the morning to now it's more like half an hour every day, and just progressively increasing it by 1 minute per week until I was very happy with how my morning routine looked. Now we've got some other people using it as well, typically other people with ADHD. That tends to be the target audience that it resonates most with. It's been very satisfying for me personally.
That's great. That's great. So you, it's a bit of a crude term, but people talk about eating your own dog food, right? The idea that if you really in software, right, in SaaS, that if you developed some software tech, you ought to be, for customer service, you ought to be running your customer service on it. Or as you said, it was something that you developed and then decided it could help other people as well. So
yeah, and that's really helpful compared to, say, with Smooth Messenger, where I didn't have a day-to-day need for sending SMS. It was a little bit hard for me to dog food it, whereas I use FocusBear for hours every day, both in terms of the habit features and also the distraction blocking features while I'm working. Makes it easier to test it and easier to talk about it.
I think there are a lot of people who could use that, even if they don't have an official diagnosis of ADHD. I think it feels to me like this culture is right, TikTok and texting, and there's a tremendous amount of distraction and a tremendous amount of small, minor things that can eat away at focus.
Absolutely.
There's something around like for every time you're distracted from, if you're focusing on something, every time you're distracted, something like it adds 15 minutes because it takes you a period of time to get back into it and to that level of focus that you were at before the notification popped up, before someone knocked on your door, before.
Yeah, context switching isn't good.
Context switching. There you go. I think there are a lot of people who would benefit from that. So what, as you were talking a little bit about competition and, when you think about competition, because that's such an important part of building a message, right? To understand how you set yourself apart and what that looks like. And I'm curious how you thought about that, how you think about it now, where you think it's going in the future, and also what do people get wrong about neurodivergence? It's kind of like next question.
Okay. Yeah, the competition side, I guess the classical advice is it's great if there's competition because it shows that there's a market demand for it. And I think that's true. But I also like the blue ocean strategy, where the author talks about the importance of finding a niche where there is potentially adjacent competition, but they aren't directly serving that niche. And that's why I've niched quite deeply towards the neurodivergent market, because there are generic to-do lists which sometimes talk about being helpful for ADHD, but there aren't really any that are made by people with lived experience. And I think that's pretty crucial because there are differences in terms of what people will trust and also how the app is structured. And that's how I've lent into it, we've got a long list of competitors on our website. Some of our messaging has been, how are we different from Todoist? How are we different from Evernote? We've got about 50 competitors that we've identified that people may use in terms of helping them to be productive and helping them stick to habits. And that has been helpful just to position ourselves against them or in tandem with them, that in some cases it's not really that we're better than them, but rather I personally use Evernote and I use some other apps as well, and they're very complementary, and trying to position it that way, that making a productivity stack composed of other apps is a good way to do it. We did a guest blog post recently with ClickUp, which was quite good for inbound traffic. And that's where it seems like it doesn't necessarily need to be competitors, but rather collaborators, that there's a lot of people trying to help overall people with their productivity, and being able to work together on different aspects of it is a good way to do it, I think, rather than fighting over the scraps of people who've already identified that they want a distraction blocker. So I guess in terms of the other question you had around where does it lead to with people who are neurodivergent and what software they might be looking for, in the conversations I've had, it seems like there's not a great deal of awareness that software could help, that there's a bigger market for that reason. It does require some education, and we're going about that by working with influencers to try and talk about, hey, if you do have ADHD and you're struggling with distractions, there are things that can help in addition to in addition to medication, which is definitely helpful for a lot of people, and in addition to working with an ADHD coach and some of the more metacognitive strategies. I think the message we're trying to convey is that you can try different things, and a lot of them are low cost and low investment, both in terms of time and money. So try them out and find out which one resonates with you.
Yeah, great points. I think this idea of collaboration is a really interesting one, and something that, having been in the medtech industry, medical devices, for 30 years, is not something that comes easily. And so more and more medtech has realized the advantage, particularly in kind of the digital health and kind of software field, to collaborations and partnerships. Can you talk or share about any successful partnerships or collaborations that have helped propel FocusBear forward? Or how do you approach strategic alliances or collaborations that we could learn from?
It's something we're in the infancy with, but the ClickUp example has been good, where ClickUp has a guest blogging program, and I applied to be a guest blogging partner, and they were happy to work with us. And we wrote a blog post around the top 10 apps for focus, where ClickUp is number 1, of course, and then FocusBear is number 2. And that it has led to some inbound traffic. And then in terms of other partnerships that we're looking at, there are some communities and some HR organizations that are going to be partners of community around productivity. And I'm also very interested in going down more of potentially the medical device pathway of working with the university and bundling in some tools around. There's some game-based interventions, for example, to help people to focus that have some research backing. And I'm interested in bundling that into the app as part of a partnership with the university. So I think that does lend credibility and also opens up some more pathways for certain types of grant-based funding.
That makes a lot of sense. So this idea of communities, right? We all belong to kind of different communities. A lot of people let's just say in the digital space generally, right? Talk about communities, build communities. I'm a part of a couple of them, not medtech focused at all. So for medtech, that idea of building a community is a relatively new one, and certainly the idea of using influencers, particularly in the social media side of the world. Typically, we've gone to, it's physicians, right, who are going to use or prescribe, or, right, and more with digital health, patients are a bigger part, or healthcare consumers are a bigger part of the conversation. What are some tips that you could give to folks around who are thinking about or trying to figure out this idea of communities? And is it something they should do? Is it something they should sponsor? How do you think about that?
Communities have been a big part of the product development process for me. There's a bunch of subreddits that, for example, ADHD programmers and ASD programmers, and then the larger one, ADHD, where I found it really helpful to be part of that, both in terms of listening to what people are posting and also posting myself and commenting and trying to generally be helpful in those communities to build up trust. And it has informed some of the way that we've built the app, that I've posted early versions in those communities and had feedback from the people in the subreddits. That's been really helpful. I guess the challenge is to not appear spammy, especially on Reddit, that there's an aversion to that you can't be posting links all the time. But if there's an overall approach of trying to be helpful, and that's how I try and approach marketing in general, that the content that we're putting out, we're trying to generally provide useful content, both in terms of the communities, but also on our blog and our YouTube and our Instagram. And I think people appreciate that, and that helps to build trust as well. It does take time, and I'm not sure that actually sponsoring it works. I think that tends to potentially come off the wrong way. But if it's an organic thing where people in the community feel like you're an active participant and being helpful, which takes a lot of time and takes time to build up, then I've found some benefits from that.
That's a great point about Reddit and that's certainly an advantage that you have, right? That you are part of those communities, but certainly other folks could join those communities, and as long as they are open and offering, useful information, like you said, you approach marketing from the standpoint of education, which I think is a really terrific way to do that. That makes a great deal of sense, and that you keep using the word trust, right? And so this concept of people talk about know, like, trust. They have to know who you are, they have to like you, and then they have to trust you, right? That's the last thing. Hold on one sec. Bye, bud. See you later. That's my 13-year-old. He looks at Reddit. So, so I think what you're talking about with know, like, trust, and talking about that third and most important piece, trust, is critically important in the communities. That makes a lot of sense. When you think about, you mentioned using influencers. When you think about using influencers, who do you choose? How do you choose them? How do you go about doing that?
Yeah, I wouldn't say that my influencer strategy is completely bedded down. I've just started with that, but the process that I followed was I initially worked with an agency that found some influencers for me, and I haven't actually launched that campaign yet, so I can't really say how it is going to go. Hopefully it will work. But what I'm thinking about increasingly now is those were generic wellness influencers, and I don't know that it's necessarily going to be a perfect fit, but I'm more going down there now, looking at who do people trust in the ADHD and autism space and working with them. So I've had a partnership recently with a guy who's got a Neurodivergent podcast, and that has been by far the most effective channel in terms of cost per acquisition. That we sponsored a podcast, and we got a huge number of clicks and signups from that. And I think it was because he actually tried out the app and has been using the app for several weeks himself. And so he was able to talk about how it had helped him. And that was very compelling then, that when you talk about know, like, trust, they already knew him, they already liked him and trusted him. And so him introducing the product in a way where it felt authentic, it wasn't just an ad where it wasn't something that he had used himself. You might find it helpful, but more talking about how it had helped him. And that's the direction I'd like to go down, finding other people within the community, potentially existing users of the product, and helping them to amplify their voices.
That is a great point. You used the word authenticity,
Mm,
right? That he had used it, he had tried it, and so he could speak from his experience.
mm,
And yeah, that means that carries a lot of weight then,
yeah.
right? As opposed to, hey, there's this new thing you should try.
Mm,
Right? It comes across differently.
mm,
So
yeah.
yeah, that sounds tremendous. And sponsoring podcasts. I am, of course, all for that. So when you think, so it's a really interesting way with subreddits. You're kind of at the leading edge of what people are doing, right? Becoming an active participant in subreddits, working with folks who are going to try and then speak to their very specific audience, who already knows them and likes them, right? And trusts them. Uh, and I thought one thing was interesting is that you were initially, it seemed initially going kind of the consumer route, which can be really challenging. And because consumers are bombarded every day with thousands of messages, buy this, try that, do this other thing. And you are looking at working, or you are currently working with physical therapists to provide home exercise programs that use the FocusBear app. Could you talk a little bit about that? Like, how did you identify this opportunity? What steps did you take to kind of decide to go into this market? And kind of what benefits do physical therapists and potential patients have in the home marketplace?
Mm. Uh, This is something we haven't gone that deep on yet due to regulatory issues. But the inspiration for it was that I had been seeking advice from physical therapists around the exercises that we include in the FocusBear app, in terms of we've got micro workouts which people do throughout the day. That's one of the things that can help with ADHD, of regularly getting up and say doing some stretching or doing some star jumps, anything to get the blood flowing. And I was seeking advice in terms of how should we tailor those exercises to make them more relevant. And one of the physical therapists that I spoke to said, hey, this could actually be good for home exercise programs because there aren't good solutions right now. And I still do think there's some promise there. I've been a little bit cautious about going deeper on it due to concern around HIPAA, that I want to, before we do anything like that, we need to make sure that we're going to be HIPAA compliant. Otherwise, there could be big penalties if we've got patient data around asking them how much did that hurt when you did that particular knee bend exercise, for example. We don't want to get into hot water around that. But later, I do think there's some potential there. And like you were saying, in terms of other medtech devices going via the physician route, I think that's an excellent way because it has the trust relationship already there, and it means that it is very tailored to the individual. And hopefully they're only recommending things that are going to be helpful to the person, and not necessarily interventions which are the most profitable for the physician.
That's a really, yeah, I hadn't thought about the use of FocusBear in that context, but there's certainly a huge swell in the availability of digital health apps, right, for a whole variety of different reasons. And different companies taking different regulatory pathways. So it's been fascinating to follow. Impaired therapeutics, for example, which went the most rigorous path, like straight up med device path, ended up folding a handful of months ago.
Hmm.
They had, I think, 3 apps that they had regulatory clearance for in the United States,
Hmm.
specifically. So, whereas other folks are doing something slightly different, like a little bit more of a middle of the road strategy.
Hmm.
So, um, but that makes a lot of sense. I never thought about it from that standpoint, that if the physician recommends it, that is some, right? That's obviously someone they know they like because they showed up at their doorstep. And there's some trust from that ongoing relationship. So So,
Yeah.
oh, go ahead.
And I guess the motivation for the physical therapist is that patient adherence to home exercise programs is normally very low. And
Mm.
our model of having the micro workouts throughout the day for office workers, I think that actually works well for me. I've had some hip flexor issues in the past and I no longer have them because I do my stretches in the morning and throughout the day.
There you go. There you go. I mean, I think that's something where community comes into play as well,
Mm. Yeah.
right? And motivation. There's some data around that in the community. So,
Mm.
yeah. So that's interesting as well. So, what are some of? Are there any other things that you'd like to share around generating awareness? You've talked about subreddits and communities and influencers, podcasts, um, particularly my podcasters specifically in the space around ADHD and neurodivergence. Anything
Yeah,
else that, oh, go ahead, that either worked or actually didn't work that you tried?
sure. I'd like to talk in terms of the community side. The other thing that's been helpful is the listening side of community, of looking at what terms are being discussed. One thing that has come up in my participation in subreddits is there's been a lot of talk about skill regression from an ADHD context, that people are finding that after they get diagnosed, skills that they previously were able to do quite easily start becoming less easy. And there weren't any credible blog posts about that at that point. And I ended up writing one, and that's now our biggest source of traffic to the website. And it's very specific. The language used is coming straight from those subreddits. And because we're able to use the learnings from those discussions, it's now ranked number one on Google, and we get a lot of click through on that particular blog. So that's something that I'm becoming a believer of looking at what's trending, say, on TikTok and in subreddits, and seeing that as where the discussion is likely to go, and then writing content both in terms of blog posts and doing some YouTube videos and potentially posts on LinkedIn around those particular topics has been quite effective.
That's a great point. It's a bit like with TikTok with the trending audio, right? Using trending audio.
Yeah, but finding the sub trends, because what's trending on TikTok as a whole is probably not relevant to the particular business, but finding within a particular niche of TikTok, like ADHD TikTok, can find things there.
And I think that's such a great example of really knowing your customer deeply and niching down, right? Knowing your target audience, and also resisting the what sometimes people say is, oh, you need a bigger market, you need to go broader. More people can use this. I mentioned that at the beginning of this conversation, right?
Mm-hmm. Yeah.
But niching down and making sure that you really resonate and provide something that is super, super useful to the specific audience is more important to get traction early on, right? Than going broader or going so broad as to, what was it? And trying to be everything to everyone, you're nothing to no one. There are other versions of that cliche out there.
Yeah, but I think it's very true. It's very hard to stand out then, that there's the competitors that are going broad and they've got much bigger budgets. So it's not really going to get any cut through if we go really broad.
Yeah, focus, and language and words, skill
Yep.
regression. Yeah, it's a great That's a great example. If folks are looking to develop other products for kind of specific niche markets in kind of in medtech, but let's say um, maybe more in digital health and kind of the app arena, what kind of key lessons or kind of insights would you have for them based on your experience?
Hmm. I guess it depends on if it's going to be a pure therapeutic device and it might require approval. The process is probably quite different, but I might speak from a device which is in the digital health space but isn't likely to require regulatory approval. And from that perspective, I think testing the standard advice around lean startup of testing very early and showing early versions of the product and not building too much upfront is pretty key in terms of getting something that people are going to like. Because in the early version of the app, it was super strict and it would be you basically couldn't really turn it off unless you put in a password. And I had feedback that while that might be appropriate for me, it wasn't really appropriate for other people. And that's something that I could only learn once I put it in front of other people and got that early feedback. And then from there, we've continued to evolve. And sometimes the feedback has been really hard to interpret, that people will just say, it's annoying. And I have to try and figure out, okay, what might make it annoying, and strip back the aspects that were too invasive early on and add more settings, make the defaults in a way that they weren't going to be annoying for people, and then still allow people like me who want a more intrusive solution to amp up the level of nudging. And I guess the other side of it too is when you develop a product, I think it's key that the people working on it can empathize with the users. I've basically almost exclusively hired people who have ADHD or autism because I figured that they're going to understand the target market and they're going to care about the product that we're solving as well. And maybe that's something that could be done more broadly in the digital health space, that if you're building an app to help with depression, then hire people who have been through that pathway before and who've experienced the challenges, who know the language that people are likely to use and can potentially give testimonials based on their own experience, and that they're likely to actually use it and dog food it.
That's a great point. One of the things I'm curious about, and yeah, it's certainly hiring people who are in the same, let's say, align with your target audience, in doing that. And I think I saw that you were attending, or it looked like you had attended a disability tech conference, and which is very broad, right? Covers a lot with that word, and certainly deficit thinking. To your point earlier, in the naming of that, uh, what what do you find often I'll include myself, the general public, doesn't understand about neurodivergent thinking, doesn't understand about ADHD, doesn't understand about autism spectrum disorder, particularly as it relates to hiring people and managing people, and what are we missing?
Some of the conversation around hiring and recruiting is around the little, almost microaggressions in the recruiting process that can make it harder for people who are neurodivergent to do well. So things, for example, that the classic thing with autism is not liking change and unexpected situations. So the gotcha approach to recruiting, where you bring someone into an unfamiliar environment and ask them questions without giving them any context or background. And often those questions aren't actually the type of questions that someone would face during the job. That tends to be a bit unfair and potentially not a good test of someone's abilities. And instead, what I've been hearing is that the right way to do it is to send out the questions in advance, to potentially do a visual schedule for the day where you might include photos showing how to actually get to the place, because Google Maps isn't necessarily going to get someone all the way into the room where they're going to be interviewed. So helping them with situations like that providing some reasonable adjustments that are going to help them to do their best on the day. And often that actually helps everyone. For example, my wife isn't neurodivergent, but she recently did an interview process that I thought was quite enlightened, where she was allowed to do it at home. They allowed you to do multiple takes of it. It was a video interview where you could see the questions and you could record your answer to it. And then if you felt like you didn't quite nail it the first time, you could record it again. And that really then allows people who are more conscientious and who really want the opportunity to invest deeply in that process and do more research. I guess there's also concerns around, does that then give an advantage to someone who has more free time? But I think it levels the playing field more than if you just go with the standard approach where it works well for people who are quick thinkers and who respond without much prompting. And if you're doing, for example, if you're hiring an improv comedian, then that's absolutely the right way to hire. Or someone who's going to be client facing and has to respond quickly to inquiries. But if you're hiring a programmer or a data analyst, project manager, I don't think optimizing for someone who is very quick in their responses is the right way to do it.
That's a really great point, like all the way around, to make sure that people know what they're going to be answering, to allow for folks who are. I'm definitely someone who will jump into a meeting and we go through and we make decisions and we're done, right? But I know that I work with other folks who need to sit with it for a bit, right? My mom was one of those people, is one of those people. I'd say, Mom, can I sleep over at whoever's house? I'll think about it and tell you tomorrow. And I'm like, I meant tonight. I need 24 hours. And I was like, as a kid, I didn't made no sense to me at all. I thought, I don't get it. But as an adult, I certainly do, right? Different people process information differently and need more time to think about it. And so I think the idea of sending out the questions in advance, right? If you want to test for quick thinking, that's one thing. If you're looking for thoughtfulness, right, and longer term thinking, and that providing them makes a lot of sense, or allowing multiple video takes. So
yeah, and also once they've been hired, giving them the agenda for a meeting in advance so they can do some thinking beforehand. Lots of little things are often part of the universal design spectrum that making these changes often benefits everyone. Another example would be open plan workspaces, which are particularly bad for people with autism, but I think are bad for everyone as well. And if we design ways that people can retreat to quiet spaces when they need to do deeper thought, that benefits everyone.
Yeah, that is a great point. I worked once in an open plan workplace, and everyone felt like they couldn't get up and walk to someone's desk because they'd be bothering someone else. They literally chat. I mean, I could see them like 10 feet, right? 10 meters away. They're chatting.
Like,
right?
And when you say chatting, you don't mean verbally chatting. Yeah, electronically chatting.
Electronically chatting, right? And if you wanted to actually talk or take a phone call, you went into a conference room, right? So it was, I felt like I was in church. No loud, only whispering, no loud talking, no talking amongst yourselves. So, but yeah, allowing these things helps everyone. The visual IDs of where they're going to go and what it's going to look like would benefit everybody. Make it more likely people are going to show up on time and less stress, right? Less stress, less worry. That makes a lot of sense. So those are all great ideas. Visual directions, questions in advance, And then, of course, on the job, agendas in advance, anything for review in advance. And those are simply best practices, right, of the best companies out there, so that when you meet, you have a discussion about the work. You're not telling people about the work, right? You're putting people in a room not because you need to subject them to the same information simultaneously, but because you want to have a conversation about it.
Yeah.
You want to hear people's thoughts. So that's the important part anyway.
And that's hard to do via electronic chat.
That is challenging, right? And words, yeah, sometimes the written words can be, in my experience, can be misinterpreted. So, which is usually when I pick up the phone and call somebody like, why don't we talk about this? I think we're missing each other somehow in that regard. So those are all great best practices. I love the visual direction idea. I know in the past, I've definitely gone to places beforehand, like the week beforehand, or tried to figure out exactly like, where is the door? Like really smaller companies are in these office parks. They all look the same. And it's not well marked. Where am I trying to get to for this? So.
Yeah. And if you're hiring someone who is, I don't know, an investigative journalist, then maybe that's a good thing to do to make it hard for them to find their way in.
There you go. It's part of problem solving. Can you find it? Can you get here? Yeah, sometimes GPS is not your friend. So, we talked about different things for kind of neurodivergent folks, for ADHD and autism spectrum disorder, and how those can translate to being better for everybody, and how different people process things differently, even if there's not some specific deficit diagnosis attached, right? And what are some of this, just flipping it over, what are some of the strengths of folks who have, ADHD or are on the autism spectrum disorder, or bringing those folks into a company? I know we're having like a hiring chat on the messaging thing, but I think it's important that for a lot of different reasons, that we have a diverse group of folks kind of coming to bear in the things that are being developed. And so I think it's important that we do better at that, to do better at product development and ultimately messaging to the market.
Yeah, and I'll try and weave in some of the messaging principles as well. In terms of the strengths, I'll turn to the Neurodiversity in Business report, which was a survey of UK-based companies where they looked at what are the things that people are struggling with, but also what are the strengths and advantages that neurodivergent people can bring to the workplace. And the advantages identified by their managers were creativity, problem solving, and hyper-focus, meaning that if you give someone who's neurodivergent a problem that they're deeply interested in and explain the context, explain why they're doing a task, they're likely to be able to get into a state of hyper-focus and come up with creative solutions and get it done very quickly to a high standard. But if you give them a mundane task, which has no explanation of why it's significant to the company, then they're likely to not want to do it, and they'll get distracted and it will take a long time to finish it. So there's again, I think that's generally a best practice of Simon Sinek's book, The Power of Why, and explaining why it's important to do a particular task and helping people align their work with their strengths. In terms of messaging, one thing I'd like to share is around the importance of getting the quantity of text and the way that it's conveyed right for people who might be dyslexic. Because often in the ADHD and autism sector, there's a lot of overlap with other comorbidities, including dyslexia. And we had some feedback early on that I had built the website in a way that works well for me, where I really like reading lots of text. I like the detail. whereas a lot of people don't like it. And what we've now opted for is a model where on our website, the initial amount of text is very brief. We only have probably 100 words in total on the web page. But then in each of the sections, we've got, for example, how is FocusBear different? And we have a section built by people with lived experience. And then there's a little drop-down arrow next to that. And if you click on that, then you see a lot more information. And the same thing for the other parts of the page. So we've tried to make it to work with people who have different text processing styles. And we have video as well. We've also thought about the font, that the initial version of the page, it had some graphically appealing textures in the background that our designer really liked. And we had feedback from people who were dyslexic that it made it really hard for them to read it, that the page felt too busy and it was hard for them to concentrate on the text. So we've got rid of a lot of the background fuzz, and we've also changed the fonts that we use on our website and in our app so that it's easier for people who might be dyslexic to read. We've got options to change to the Open Dyslexic font and the Poppins font, which are better for people who have dyslexia. And that might be something for other companies to consider too, making sure that you're testing your website with people who are dyslexic and who have different neurodivergences, and making sure that it's actually possible to absorb the marketing messages that we have, because otherwise you're losing a whole subset of the population.
It's interesting because I've certainly considered contrast, right? Some of the typical things that, at least in the US, are required at certain levels of company growth, around legibility and around color contrast. There are a few different ones. But I hadn't heard that there was a font, like you called it the Open Dyslexia font.
Yeah, there's a few fonts, and the research suggests that there's no one gold standard font for dyslexia, but what actually helps is if people can choose the font. And I think for websites, that's fine. People can use Chrome extensions to change the font. But if it's in an app, then it's a bit harder for them. So it might be something to consider as part of accessibility settings. That's one thing that we added recently, the ability for people to choose their preferred font, including Comic Sans, which I despise from a design perspective, but is apparently quite good for some people.
Yeah, I would not have guessed that. So yeah, I think, when we talk about inclusion and access and, we continue to learn about becomes important to kind of include more and more people, right? As we learn more, we do better along the way. So allowing people to choose their fonts. Yeah, that's really only something I thought about relative to people who, were literally in their 80s who had asked me to help them with some things. And I went online and looked for and it's like sans serif, X high. So I printed out don't condense the font, leave lots of white space. This is you bring up another really important point about accessibility in fonts and reading dyslexia. So how many, because people may not know, do you have any data? What data do you have on the prevalence, incidence prevalence of neurodivergence kind of generally in adults or
stats
kids?
indicate around, in adults, the stats indicate that it's between 15 to 20% of the population. And that's probably an underestimate, because we know that, for example, women are less likely to be diagnosed with especially autism and ADHD because it presents differently. So there's, I think, quite an increase in diagnosis rates at the moment as psychologists and psychiatrists become more aware of how it manifests in people who weren't hyperactive as children or weren't doing the stereotypical autism things of lining up their toys in a row. And I think because there's more acceptance now as well, people are more open to looking into it, that we're moving away from the deficit model and hearing from influencers who have done amazing things with their career. And they talk about how the ADHD is a superpower, for example. And I think similar for dyslexia, that one of the people that I know, he's got an email signature which says, "I'm dyslexic," which means you should expect big ideas and small typos.
That's great. I love that. That's terrific. Wow, 15 to 20%. I would have never guessed. And what's interesting, what you mentioned about women being kind of under, it being an underestimation and presenting differently, is that, and this is a couple decades ago, that they determine women are more likely to suffer heart attacks and die than men, because women present differently. And who had they done the bulk of the research on in the past, right? The young, healthy male, 18 to 35. So they didn't understand that it can present very differently in women than it can in men.
Yeah,
So,
and I think there was another example of people in the crash test dummies, that they were designed for male bodies. And so cars were being built in a way that was going to reduce the incidence of injury for males, but actually made things worse for women when they were in an accident. So hopefully we can start to factor in more diverse populations when we're testing our medical devices to make sure they work for everyone.
Yeah, 100%, absolutely. So yeah, and I think the spectrum of people that you want to have us evaluate what you're doing and look at what you're doing and work at the company, and more diverse in all ways, the better. You said earlier, the better your product's going to be.
For
more
sure.
likely you are to be successful, right? And the research backs that up. So, so that's great. Is there anything else you were hoping? I have a couple more fun closing questions, but before that, was there anything you had wished I had asked you that I haven't asked that you wanted to share?
Maybe the engineering approach of marketing, the messaging.
Sure.
I don't know that I've got a huge amount to share there, apart from just doing experiments, for example, looking the typical A/B testing approach of changing up the main title on our page and looking at what that does to conversion. And I find that quite fun, because in the past I'd seen marketing as a bit of a dark art and more of an art than a science. But I think with the modern tools that we have, we're starting to see how it can be quite a scientific process, and experimenting in ways like that, and letting the whole team have ideas about what could we change here and how could we make it in a way that's going to be more convincing for people, being able to run those experiments. I love that aspect of it.
I love the idea. You use the word experiments. I love the idea of, right, it's a design of experiments, right? We call it, marketing people call it A/B testing, right? We're going to send out 1,000 emails. We're going to put one subject heading on one and another one on another one, right? Or like you said, change it up on the website and see what shifts up with the traffic, right? So, but it's a design of experiments, figuring out what all the variables are and changing them in a thoughtful way, and then seeing what the data says.
Yeah, takes the ego out of it.
Yes, it takes the ego out of it, and I think it's fascinating that you found that there are more kind of thoughtful ways of doing marketing, right? That are more data driven, right? calling them experiments and calling them variables and making me think about I use language in marketing that in medical devices that ties out to design control, which is an FDA and kind of an EU, and they're harmonizing, the Australian code as well. It ties to that so that we're all speaking from the same language. But I love the idea of instead of calling A/B testing, why do we need to call it A/B testing? Why do we need to come with some completely different name for what is an experiment with
Yeah.
we're testing which variable, one of two works the best, and what's the data from that? So it's exactly what it is. You have me thinking. So it's anything else?
No, fire the closing questions at me.
All right. If you could travel back in time and give one piece of advice to your past self when you started FocusBear, what would it be and why?
Don't outsource the marketing. I hired a marketing agency for a while, and I mean, part of it was good. I think they did a good job with the brand and the visual identity, but I think it would have been better if I had taken ownership, because I felt like it wasn't something that I could do, that it wasn't my skill set. And that's not really true. It's something that I'm growing into, and that the more time that I put into it, the better a grasp of the subject that I have and the better our overall messaging will be. So I wish I'd started earlier with that.
There you go. I love that. I love that. I think that, yeah, you know the target audience, right? If you know the target audience the best, that's the most important thing to know in order to do the design work. That's what has to inform the design work. So, and this is the other one I wanted to ask you. So, given the fact you're from Melbourne, so you essentially live on I know it's a continent. I understand this. It's a very, very large island. If you were stranded on a desert island and could only have one piece of technology from FocusBear, like one piece of it, not all of it, what would it be and why?
I think your FocusBear would be at all helpful in that situation. I don't think I'd have many distractions to worry about, and it would be an existential crisis. But maybe to lift my spirits, I think the motivational message each morning, we use OpenAI to create a customized motivational message. So maybe having that each day, that it can tell me, you can do it, Jeremy, you can survive, you can build that hut. That might
climb that coconut tree.
Yeah.
All right. Motivational message. I like it. So that is all I have for today. So thank you so much for joining us today on the Message Engineer podcast. Really enjoyed talking with you about how you've navigated this journey with ADHD and level 1 ASD in developing FocusBear, and as a founder with a 9-to-5 is really fascinating. So congratulations on that. And if people want to find you, where should they go?
You can find me on LinkedIn, Jeremy Nagel, linkedin.com/in/NagelJeremy, I think is the URL, or otherwise on focusbear.io. If you fill out the contact form there, I check all those emails.
Fantastic. Well, thank you so much today for your time, Jeremy. It's been a joy and a pleasure talking to you.
Likewise. Thanks a lot for having me on.
So we'll see you next time on Message Engineer. Be sure to follow and subscribe. That's it for now.